This webinar is brought to you by the Active Aging and Lifelong Learning Subcommittee. Hello and good afternoon. My name is Jeremy Seah, and I am the chairperson for the Active Aging and Lifelong Learning Subcommittee. Today's webinar will be an hour long with 30 minutes for questions and answers. You can type up your questions and you can vote questions that are of great interest to you. The next event is on 7th of October from 4:30 to 6 p.m. Smart Solution for Joint Pain by Dr. Gopal Singh, orthopedic surgeon, subspecializing in orthopedic oncology, joint replacement, and sports injury at Farrer Park Hospital. Let me introduce our speaker for today. He is Dr. Eric Silverchong, a senior consultant, interventional cardiologist at Farrer Park Hospital. He was a former director of cardiology and directed the cardiac catheterization lab in several structured hospitals. He set up and pioneered emergency 24/7 coronary angioplasty services, pacemakers, and defibrillator services in government hospitals. He subspecialized in advanced interventional cardiology, cardiac pacing, and device implant procedures. Without much ado, let me hand over to Dr. Chong. Dr. Chong, it's all yours.
Hello, hi. Good afternoon, ladies and gentlemen. It's my pleasure to give this web-based talk today. Yeah. Wish everybody a good afternoon. Yeah. Yeah. So today we are going to talk about a common topic, which is we'll go through the topic on sudden cardiac deaths and heart attack. Yeah, feel free to ask me any questions later on. Yeah. Okay.
Just click.
Yeah, heart attack versus cardiac arrest. So from the picture on the left side, a heart attack is commonly caused by a sudden blockage in the coronary heart arteries, whereby cardiac arrest is commonly caused by a sudden electrical short circuit, whereby the heart beats very fast and very irregular. During that time, the heart becomes very weak and only have maybe 5 to 10 minutes time to save the patient before the body and the brain is being starved of oxygen. So these are the main principles comparing acute heart attack and cardiac arrest. But of course, in a large percentage of patients who suffered from cardiac arrest, heart attack is actually one of the causes. We do the next. You can see, because recently there are so many COVID cases, it was found that COVID-19 actually increased risk for heart injury and triggers heart attack. An early publication in Journal of American Medicine suggests that up to 27% of patients who had COVID-19 infection also have signs of heart injury and causing elevation of cardiac enzymes, troponin, regardless whether they have lung infections or not. And in particular, hypertensive COVID patients had higher risk. And during hospitalization, COVID patients with cardiac injury shown more frequent malignant, life-threatening heart rhythms, as well as usage of mechanical ventilations up to 60% as compared to patients with normal cardiac enzyme levels. And the mortality rates of patients, COVID patients, who are taking one particular type of hypertension medicine, we call this angiotensin converting enzyme inhibitors, one of the very commonly used hypertension medicine, actually in fact showed a higher risk of deaths comparing to patients who are not taking this medicine. 36% versus 21% is about like almost 15% higher chance of mortality. You can see in this diagram, besides affecting several organs, namely the lungs, the brain, and so on and so forth, by the COVID-19 virus, on the left lower part of the diagram, the heart and the blood vessels can be easily attacked by the COVID virus. When the virus enters the cells, which likely include those lining of the blood vessels, by binding to the angiotensin converting enzyme receptors on this cell surface, the infection can also promote a sudden formation of blood clots and hence leads to heart attacks as well as increased inflammation in the heart muscle. Other common symptoms of COVID-19 involving the cardiovascular systems include chest pain, a sudden change in electrocardiogram, irregular heartbeats, high levels of cardiac enzymes, troponin, released in the blood during heart injury, inflammation of cardiac muscles, decreased blood flow in coronary arteries, formation of blood clots in the heart, in the legs, and even in the arms. And in a more severe form, cardiogenic shock, where the heart cannot pump enough blood to supply the vital organs. And lastly, heart failure. And in a very recent publication in the US, it shows that heart attack death rate has actually doubled during this COVID-19 period, particularly in two major states, Oregon and Washington, D.C., two areas where we saw large outbreaks of COVID-19 virus. People who suffered a second heart attack were found to be more than twice as compared to the previous year. Yeah. And even in Singapore, we have at least some cases of heart attack in COVID-19 patients. In fact, there was a Straits Times publication in May this year. There was one Indian patient who was diagnosed to have COVID-19 and died suddenly of acute ruptured myocardial infarction as a result of acute blood clot formation inside the coronary arteries. And talking about acute heart attack, even sadly, one of our colleagues, Dr. Ng, who was head of surgery in SGH, he died of a sudden cardiac arrest. Yeah, so he was actually doing exercise in the East Coast Park, and he just suddenly collapsed. Yeah, yeah. And then other case examples include this case whereby a Singapore family just traveled to Japan for a holiday, and this cardiac arrest just happened suddenly. Essentially, what is very special about this condition is that this condition always comes acutely, even though you are maybe just doing leisurely, doing some leisure sports or having holiday. So therefore, it's very important for us to actually check the heart before, and then try to prevent this condition. Yeah. One important and very useful way to save life in patients, to prevent death in patients who suffered from cardiac arrest is actually to perform cardiac resuscitation. By performing compression using our hands, we can actually save a number of patients. We do conduct this type of courses. We call this course Basic Life Cardiac Support, BCLS course, that you can attend in hospitals, and then to learn the techniques to save patients' life during cardiac arrest. Okay, in Singapore, over about 1,000 cases of sudden cardiac death happens each year. That's equivalent to at least 3 cardiac cases per day. Yeah. Now I'm going to go through some other common causes of cardiac arrest. Other common causes of sudden cardiac arrest include one is infection-induced myocarditis, which is inflammation of the heart muscles. Two, severe physical exertion in patients with underlying structural heart disease. Three, coronary heart disease, or what we commonly refer to as ischemic heart disease. Fourth, patients with weak heart, heart failure, and cardiomyopathy. Then finally, I will touch a little bit on drug or toxin-induced heart disease. Okay. So viral myocarditis, in fact, COVID-19 is also a form of virus attack that can cause viral myocarditis. So in this article, which was published last year, at 30 years old, Mr. Lim never felt more miserable in his entire life because what seemed like a common flu almost killed him when he presented with sudden onset of myocarditis. Yeah, but luckily this patient survived, but he has to suffer the consequences of this disease. Another patient who was a young patient in his 20s actually died during a football match because of viral myocarditis. Yeah. Okay, this patient was in the newspaper interviewed myself. What happens to this patient is that he only had minimal symptoms, but he had this mild breathlessness and preceding flu and some diarrhea before he suddenly collapsed during a football game. Of course, dengue is a main concern in Singapore, in particular for year 2020. There are a large number of cases of dengue fever. And dengue is a common cause, it's fairly common cause of bleeding. In a small number of dengue patients, it can sometimes turn into myocarditis. It's also known as inflammation of the heart muscles. Okay, one common signs of that the heart is being affected in dengue fever is that the heart rate tends to drop to a slower rate. So bradycardia, the medical term bradycardia refers to slowing of heart rate, can be quite common as up to 10 to 20% in patients who developed more severe dengue fever. See in this ECG, the heart rate actually dropped to 38 beats per minute. You can see in patients who have dengue hemorrhagic fever, the critical phase is actually in the 4th to 7th day, especially when the fever starts to subside. So when the fever starts to come down, the various complications involving sometimes the heart muscles can occur. Other complications like bleeding, shock refers mainly to a drop in blood pressure, and the organ impairment can occur. If the patient is unlucky, when the heart muscles is being affected and caused by this dengue-induced myocarditis, the risk can be very high. In fact, a number of mortalities of these dengue patients were caused by myocarditis. Yeah. So this is one particular area that is good to know. Yeah. So what happens during heart injury in dengue patients? So there are several mechanisms. One mechanism is, you can see on the charts, potential myocyte infection and during myocarditis. Another mechanism is changed intracellular calcium metabolism, which can trigger abnormal heart rhythms, such as bradyarrhythmias, which is a slowing down of the heart rate, change of ST segments, which can induce ischemia or reduction of blood flow, blood supply to the heart arteries. Altered coronary microcirculation, reducing blood flow to the small branches in the heart arteries, and causing myocardial edema, is a swelling of the heart muscles by inducing leaky small capillary vessels in the heart muscles. Yeah, these are the various mechanisms that can occur in severe dengue infection especially when the heart is being involved. Okay, the number 2 section, we will touch on sports-related sudden cardiac deaths. You can see in this article, a multi-time Australian and Hong Kong record holder, Mr. Kenneth Toh, actually died suddenly and tragically at the age of 26 during a routine swimming practice. During Standard Chartered Marathon, Mr. John Gibson died suddenly. During the marathon, caused by a sudden heart attack. And then 58-year-old Japanese runner dies during a Maybank Bali marathon last year. And then in Singapore, in 2018, a former traffic police officer dies after completing a Safra Singapore Bay Run Army Half Marathon. Yeah. So what happened in these patients, why they collapsed suddenly during or after running, is that commonly during autopsy, when we take out the heart, we check the heart muscles, we found that these athletes may have enlarged heart. We call this athlete's heart. This could happen during chronic strenuous exercise. You can see the pictures on the left side. There's a normal heart with 4 chambers, 2 big chambers, 2 big ventricular chambers on top, and 2 small atrial chambers at the bottom. But in some athletes, the heart muscle actually grow bigger and the chamber size can dilate. I can see the heart looks bigger in the right side. Yeah, next. So when the heart grows bigger, the muscle may form scar tissues. And these scar tissues may trigger life-threatening heart rhythms. Like, for example, in this case, development of acute ventricular arrhythmia. We call this ventricular fibrillation. If this thing happens suddenly, the heart will stop beating, and normally the patient can die within the next 10 minutes. Yeah. And commonly, this life-threatening arrhythmias happens in athletes who engage in vigorous sports activities. In fact, our Singapore Sports SG introduces a new recommendation to enhance sports safety. One of the code is to avoid sprinting towards the end of a marathon, unless the person is very well trained. Yeah. And what happens if this patient develops a sudden cardiac arrest? In Singapore, the survival rate based on statistics is only about 11%, which is actually lower compared to other cities such as Seattle, Tokyo, or Seoul, where the survival rates are up to 50%. Okay, then I would go on to the third point, talk about the most common cause of cardiac arrest, that is heart attack. During heart attack, acute coronary plaque rupture develops. So you can see in the pictures, in the earlier days, the cholesterol levels in the bloodstream increases. Over time, the plaque forms inside the arteries in the heart. And covering these cholesterol plaques will be a layer of thin caps. You can see this white layer of caps actually covers the yellow cholesterol plaques. When the body is under a sudden stress, it could be after a heavy meal, fatty meal, during a vigorous exercise, especially when the person is dehydrated, a sudden rupture of the cap can happen. And a blood clot can form suddenly around the ruptured cap and causing a sudden blockage of the heart artery. That is the main mechanism during acute heart attack. Yeah, you can see this picture during a coronary angiogram. On the left side picture, the right coronary artery is acutely blocked. So what we have done is to put a tube at the mouth of this artery and put a special device to suck out the clot. After the clot is being removed, the shape of the artery can be seen on the right side. So this is exactly what happened, what can happen during acute heart attack. And then in another case example, you can see we can actually put in small cameras and do histological study to examine what happens during acute plaque rupture or acute heart attack. You can see on the pictures at the right side there is formation of blood clots with cholesterol plaques in the left, right upper image. Yeah. Okay. And the myocardial infarction, you can see comparing a normal heart on the left side and very fatty, damaged heart in a patient who had a heart attack and died from the heart attack. You can see the difference. A lot of patients actually have this fatty heart. During an echocardiogram or ultrasound study of the heart, we can actually check on all these things. Yeah. You can see a heart attack can also happen suddenly. For example, just on flight, we noted that Miss Fisher wasn't breathing for 10 minutes or so during the flight. She suffered from acute heart attack. Yeah. And then one of our Singaporean dentists died suddenly during his holiday in Maldives. Yeah. And in quite a number of patients, silent myocardial infarction can sometimes occur before sudden cardiac death. Sometimes this thing can, this silent myocardial infarction can occur during sleep. Yeah, especially in patients who have sleep apnea. Okay, the fourth point I want to point out is that overworking and stress is another common cause of sudden cardiac arrest. Yeah. For example, in this news article, a Malaysian, 31 years old, who had been commuting to work daily from JB to Singapore, died due to a sudden cardiac arrest after fainting at his doorstep. And then in South Korea, one 51-year-old doctor death actually shed light on harsh working conditions of emergency medical doctors. And then one of our Singapore doctor dies on the way to work in New Zealand. Yeah. Then number fifth, you can see this one of the famous singer, George Michael, died of a dilated cardiomyopathy. His post-mortem found that the singer died of a very dilated cardiomyopathy with enlargement of the heart chambers with chronic cardiac muscle inflammation, myocarditis. We believe the cause of his death was attributable to long-term drinking of alcohol. Yeah. And of course, other causes of sudden cardiac arrest include drugs and toxin causes. King of pop, Michael Jackson, died of sudden cardiac arrest caused by the combination of prescribed drugs, including propofol, sedatives, and so on. Yeah. And then our king of rock, Elvis, died of heart failure at age 42. Then there are some other rare conditions that may trigger acute heart attack and sudden death. One relatively common heart rhythm disorder, what we call this as Brugada syndrome or sudden death syndrome, can occur in this part of the world, whereby the heartbeat can go very fast and very abnormal during sleep. Yeah. In Southeast Asia, in particularly Thailand, we actually describe this sudden death condition during sleep as sudden adult death syndrome. Yeah, and this syndrome has a disproportionately higher chance of affecting East Asians. Even in the UK, there was case report on such conditions. For example, in this case, which was published in the news, a young lady in her early 20s passed away suddenly from sudden arrhythmic death during her sleep. Yeah. Finally, sometimes structural heart disease may be a contributing factor to sudden collapse. For example, this case, Loyang Secondary School student dies after collapsing during a 2.4 km run in the school. He was later on diagnosed to have structural heart valve disease, a problem with the valves inside the heart chambers. What he had was this condition, which can be quite common, mitral valve prolapse. You can see on this echocardiogram image on the left, showing normal valves. That's the valves opening and close. It's like a door inside the heart chamber. And on the right picture, the valve is floppy and is not closing properly. During exercise, if the valve cannot close properly, the blood flow inside the heart, the hemodynamic of blood flow through the heart chambers can be greatly affected. And then if the person exerts too much, the blood pressure may actually drop during the run and cause a sudden stopping of heartbeat. And the heart muscle can actually becomes very weak during exercise. Now I'm going to touch a bit on the physical signs and symptoms to take note. So just to educate about some certain symptoms and signs that may indicate a higher risk of having underlying heart disease. For example, in this case, Michael Clark Duncan, 54, who dies in hospital after suffering from acute heart attack. You can see one risk factor in men is apple-shaped abdomen. So if you find your tummy is very big, protruding out, it can be caused by visceral fats surrounding the abdomen. And in many times, this patient may also have fatty heart. Like the example I showed you earlier on, heart attack, the postmortem autopsy showed a thick layer of fat surrounding the heart muscles. Of course, eating habit, eating a lot of processed red meat, deep fried food, sometimes seafood like, for example, cuttlefish, full cream dairy product, full cream milk, cheese, and so on and so forth. This food contain high cholesterol levels and will increase the risk of hyperlipidemia and heart disease. High body weight, high body mass index. John Candy died of heart attack during a sleep at 43 years of age. He has a high body mass index. Increased waist to hip ratio. So it's particularly true in men. If we measure our waist for men, the recommended waist size should be below 40 inch. And for lady, it should be below 35 inch. So if you do a measurement for yourself and realize that the waist circumference is too high, especially when comparing to the hip circumference, that's a marker for increased risk of having heart disease. Another thing that we can actually screen is calcium score. It can be checked easily using a special imaging modality. For example, even President Trump, who had checked his own calcium score and showing a gradual increase in his calcium score. Yeah, a high risk of heart attack if the score has increased beyond 100. Yeah. Overstress, needless to say, late sleep. Yeah, 3 Chinese hardcore football fans died after World Cup all-nighters, which happened in year 2014. Smoking. Yeah. Next. Smoking is a known risk of heart disease. You can see at least 2 of the persons here, I believe, could have suffered from acute heart attack. The Maradona, the king of football, is known to have a severe heart disease. Perhaps Mr. Kim from Korea, who may have suffered a major heart attack quite recently. Alcoholic-induced cardiomyopathy. So for men, we generally recommend try not to drink more than 2 to 3 glasses of beer or wine per day. Okay. Other signs that are of interest include this special sign called the ear lobe crease. Is essentially a development of a line cut across the lower part of the ear lobe. It's believed that a small blood vessel supplying the ear lobe is blocked by cholesterol plaques. Yeah, and this artery is quite close to our carotid artery in the neck. It can be an early sign of underlying severe heart disease. Yeah, so you can see Mr. Bush, right, had a 95% blocked coronary artery, and comparing to President Obama, Bush had a severe, quite obvious ear lobe cleft. And we normally don't see ear lobe cleft in younger people, but you can observe in older patients, especially older people who have heart disease. They may show ear lobe cleft. Other signs include plaque deposit on or near the eyes. We call these plaques as tensy lasma. Yeah. You can see this picture. If you focus very closely at the left eye, in the inner corner of the eyes, there's a yellow plaque of Mona Lisa. Yeah. So it was actually diagnosed that Mona Lisa also had a high cholesterol. And this was actually published in Israel Medical Association Journal 16 years ago. Yeah. Other signs include formation of this special rim of whitish rim in the eyes. The medical term is corneal arcus. Sometimes this arcus can happen in older person, but if you develop this white rim in middle age, that is a prominent indicator that the person may have underlying heart disease or artery blockage. Other interesting signs include thickening of the Achilles tendon due to cholesterol deposit. Some plaques near the knuckles in the picture B. More obvious plaques around the soft tissues near the eyes, and then some cholesterol shadows underneath the pupil. Yeah. Dry skin, in particularly in diabetes patients, is a common sign to indicate that the person may have blocked arteries in the lower leg, yeah, in the feet. And peripheral vascular disease is a risk factor of coronary heart disease as well. So patients with blocked artery in the legs are more likely to develop blockage or choked arteries in the heart and the brain as well. Yeah. And of course, in some patients, you may see signs of impaired blood circulation in the peripheral blood vessels. For example, you can see tortuous arteries, change of color of the feet, and especially if you compare both feet, if you realize the colors are different, it's an important sign to take notice, and you should see a doctor without delay. Swelling, edema of the legs, that can happen in patients with weak heart or heart failure. Okay. Clubbing of the fingers. This sign is quite common in the olden days, but nowadays it's getting a bit less. Essentially, in patients with more advanced heart disease, swelling of the fingernails, the bed of the nails can happen. Yeah. And in some patients, if you observe the neck, if you see a dilated neck veins, it's a common indication of weak heart failure with water fluid built up in the lungs. And when the pressure in the lungs increases, the veins the veins in the neck can become distended. You can see the ear, there's also like one or two lines in the earlobe. So this patient has both a dilated neck vein as well as earlobe crease. Other more interesting signs include, in some cases of endocarditis or infection of the heart valves, sometimes you will get these red spots called Janeway lesion or oscillate nodes, like nodules, painful nodules or spots in the fingers and sometimes in the toes. Markers for high uric acid, you may get, because high uric acid is also one of the indications that the patient is eating too much meat. The meat contain high uric acid levels, and then sometimes in more chronic cases, the uric acid crystals may deposit in the finger joints as well as over the ear cartilage. Male pattern balding is also, again, associated sign to heart attack. For example, the previous Vice President Dick Cheney, who suffered from heart attack at a very young age of 37 years, and then subsequently he received heart transplant at age 70. Sleep apnea, sleep snoring deprive our heart and sometimes the brain of oxygen during sleep. That will increase the risk of heart failure, irregular heartbeat called atrial fibrillation, as well as heart attack. Bubbles in the urine, if you sometimes wake up in the morning, you see urine bubbles, that can be an indication of problems with the cardiovascular systems and sometimes diabetes, proteinuria from kidney disease. All these can be an early sign of having underlying diabetes or heart disease. In a more severe form, pinkish or frothy bubbling in the sputum is a common sign of patients with heart failure or weak heart. Other more common symptoms. Now we move on to symptoms, including chest pain. The medical term is angina. Especially this symptom is in particular referring to exertion. So it's a worsening pain on exertion, especially say for example, walking fast, climbing staircases. Exertional breathlessness in association with choking sensation. Palpitation, sensation of raising of heart beat, and this symptom can be even more risky if it is associated with a sensation of fainting or passing out. Cold sweat. During cold sweat, or the medical term named diaphoresis, the heart actually may become weak, and hence the body secrete adrenaline, which causes this cold sweating. In women, female patients may have atypical symptoms, such as tiredness, lethargy, sometimes gastric discomfort and numbness. And if, for example, in a female patient who never had gastric problem before and developed frequent onset of gastric discomfort, besides checking the stomach, it's also good to have a simple check for the heart. Yeah. Headache and giddiness can occur in patients with uncontrolled hypertension, which is another risk factor for heart disease. Next. Sudden onset of blurring vision, sudden weakness due to increased risk of embolic stroke. In patients with underlying atrial fibrillation or irregular heartbeat, a small blood clot can form suddenly inside the heart chambers and causing increased risk for sudden blurring vision or sudden stroke. Yeah. how we prevent all these sudden heart attack and cardiac arrest? Some of the useful advice include, firstly, check if we have any signs and symptoms, as I mentioned earlier on. A very useful test is a simple ECG treadmill test, because a lot of times sudden cardiac arrest happens during running. By far, running, marathon running, vigorous exercise running is the commonest cause of sudden cardiac arrest, especially in middle-aged people. Yeah. Of course, when our age is over 40, or when we have some family history of heart disease, for example, one of our parents may have a heart disease, heart attack, it's good for us to have a baseline check. Yeah, especially what we can do is a ECG. We can do a treadmill test once we reach 40 years of age. And then once diagnosed to have some form of heart disease, hopefully it's just mild heart disease, earlier form of heart disease, we can actually join a cardiac rehabilitation program to reduce the risk. Yeah, okay. I think this summarizes all the slides for today. Thank you for your attention.
Thank you, Dr. Chong, for an interesting presentation. We now take questions from the floor. If you have questions that you want to Dr. Chong to address, please type me your questions. If the questions are also of importance to you, you can just, instead of typing it, you can just vote it. Dr. Chong, the first question we have here is there any truth about drinking warm water before sleeping?
Drinking warm water improves the hydration status of the patient. So dehydration will increase strain to the cardiovascular system. So drinking warm water is actually good to prevent dehydration. Yeah, it's useful. Sometimes I do have patients who have postural-induced low blood pressure, postural hypotension. Sometimes they wake up at night to go to toilet. Then this group of patients may complain of dizziness. So if they do drink 1 glass of warm water before they sleep, it can help to reduce sudden giddiness when they stand up suddenly at night during sleep. Yeah, it's more useful in older person or in person who suffers from postural related dizziness. Yeah.
Okay, thank you very much, Dr. Chong. The next question we have here is, what does the calcium test for heart disease involve? If they are, okay, that's one question from the same. Yeah, let's answer the question first. What does the calcium test for heart disease involve? The next question is there, if there are bubbles in urine but no other symptoms, is it still an indicator of possible heart disease?
Okay, calcium test is like a simple X-ray. Basically, the person lie down in a scanner. The scanner is very fast. It looks like a donut, like a CT scan. So it only takes less than 1 minute to perform. Essentially, the scanner is able to detect the amount of calcium deposit in the arteries of the heart. In a very healthy person, we should have 0 calcium. So the calcium score should be 0. Yeah. Just now I showed one slide on Mr. Donald Trump. Yeah. So any calcium score more than 100. Yeah, there's a very special algorithm to code the scoring. If more than 100 is considered as moderate, and any score more than 400 usually indicates severe amount of calcified plaques in the arteries. And those patients will need to go for a coronary angiogram check. Yeah, if the calcium score is mild, but if it's present, for example, 30, 50, then depends on our age. It's very important for the particular person to take precaution, maybe reduce the risk factor. For example, if he eats a high-fat diet, then he needs to improve his diet. Yeah. Then regarding the bubbles in the urine, what we can do is to, usually if you see bubbles in the urine, sometimes it can be caused by dehydration. Depends on the age of the person. So it's important to have check. One simple check is just send the urine sample to the lab to have a simple check. The urine test can check the presence of glucose, sugar in the urine, bacterial infection, blood cells, protein. So if we find out there is actually protein in the urine or bacteria in the urine or sugar in the urine, then we can advise the patient to do further testing to exclude systemic disease, for example, diabetes, kidney disease, and heart disease. Yeah, so as long as you see a lot of bubbles in the urine and it's quite frequent, maybe every few days you'll see presence of bubbles, it's useful to take note and get a more thorough check. Yeah.
Okay, thank you, Dr. Chong. Initially, you showed the survival rate on your slides, the survival rate of heart patients being in Singapore a very low number. The question here is, they are curious to know why the survival rate in Singapore is lower than other developed countries. Aren't our medical facility on par with developed countries?
Okay, this survival rate is talking about out of hospital cardiac arrest. So essentially, this patient collapsed before outside the hospital, maybe on the road at home. So what's the difference is that more people in those cities like Japan, Korea, they attended they attended the basic life cardiac support courses. So a lot of them knows how to do cardiac resuscitation as a passerby. Whereby in Singapore, I believe the number of qualified or people who are trained to do cardiac resuscitation is still less compared to those countries. So it's good to go for the courses which those courses take about 1 to 2 days to learn how to do resuscitation. Yeah.
Okay.
And then the other thing is the availability of the defibrillator. For example, in Changi Airport, we will have the defibrillator. But if say on the road, if say this person is jogging in a park, it may not be very easy to get a defibrillator machine nearby. So actually, there are two courses that we can attend. One is BCLS, Basic Cardiac Life Support course. The other one is AED, Automated Defibrillator Training course. Yeah, so if I believe if everybody in Singapore go for the course and train, then our success rate will be on par with those countries, maybe even better.
Okay.
Yeah.
Okay. So it's about training, yeah, getting ourselves trained up.
This is talking about collapse outside the hospital. But if the patient already reached the hospital and then he collapsed, but still alive, I think our facilities will be on par to those countries, or maybe even better. Yeah. So based on the statistics, about for patients who suffered from very acute heart attack, about 1/3 of the patient will die before reaching the hospital. Among the remaining 2/3 who reach the hospital, another half of them, 1/3 may die eventually. And then we only manage to save the remaining 1/3 or so. Yeah, so it's essential, most important thing is to learn to recognize the signs and symptoms and get it checked and then prevention. Yeah, because essentially we'll miss 1/3 of the patient will not be able to reach the hospital. In fact, more than 1,000 patients will die suddenly based on the statistics. In Singapore per year, every day will be like 3 to 5 patients will die suddenly. Yeah.
Okay.
From cardiac cause, yeah.
Okay. Thank you, Dr. Chong. The next question is, in case we are not aware of our heart condition or latent heart disease, is it safer to brisk walk instead of jog?
Yeah, I think one important marker to monitor is the heart rate. Yeah, we presume the normal heart rate is about, say, 60 beats per minute, 1 second, 1 beat. If you do brisk walking, which normally keeps the heart rate to about, say, double the normal rate, about 120 beats per minute, normally it's quite safe. But then if the person start running, the heart rate may go up to 3 times, say up to, the heart rate may go up to, say, 160 to even 180 beats per minute, then the risk will increase. So if the person, depends on the age, if very young person with no signs, 0 signs, no family history of heart disease, relatively healthy lifestyle, maybe age only 20, the risk of him having problems is very low. But if another person, age 50, who has a certain amount of stress, not much careful with the diet, and he wants to engage into vigorous running and so on and so forth, or vigorous exercise activities, if I were him, I would at least go to a GP, do an ECG, maybe perhaps go to a screening center, cardiologist, to do a treadmill test. But definitely, if you end up walking, is definitely safer compared to jogging in terms of cardiac disease or cardiac arrest prevention. Yeah.
Okay. The next question is rather long. Let me read it out. Okay. One of my relatives had a stent implanted along the LAD done sometime 8 years ago. Recently, restenosis occurred. Another stent was placed on the same location. My questions are, 1, how many times can restanding be done on the same location? 2, besides restanding, are there any other treatment alternatives? And 3, can plaque be removed in a surgical process safely?
Okay. Yeah, thank you for the good question. Because the first stent was implanted 8 years ago. Firstly, I think 8 years ago we were using the older generation stent. The stent may not have medicine coating. So what we call these bare metal stents, bare stents. The chance of reblockage in the bare stents is fairly high, can be up to, say, 20%. If bare metal stents get blocked again, sometimes in about, maybe around 30% of the time, we can implant a new generation stent, drug-coated stents or drug-eluting stents inside the old stent and open it up. Normally, no more than 2 times in the same location. Because if we, like for this case, we put in a second stent, the stent will be inside the first or the older stent. So among the same segment of the blood vessel, there are actually 2 layers of stents. Yeah, so the stent struts are actually quite thick in the inside the lumen of the blood vessel. The chance of having problems is higher compared to another person who only received single stent. Yeah. If the patient do get blocked again the 3rd time, there's a newer technology, newer device we named drug-eluting balloon, which can be used to open up the blockage without leaving further stents inside the old stents. Just balloon, release the drugs, and then we remove the balloon. Yeah. So at the moment, for myself, I've done many thousands of angioplasties. There are a number of patients which I need to put in a second stent inside the old stent. Typically, it's a bare metal stent, then have to put in a drug-coated second generation stent inside. But I have never put in a 3rd stent inside the second stent. Yeah, but in the world, there are some cases which require 3 layers of stents, but those are very rare, and the risk will be much higher. With regarding to whether the plaques can be removed by surgical process safely, this can commonly happen if the plaque is formed very acutely. For example, during acute heart attack, there's a soft plaque rupture, with blood clots. So we can actually suck out the blood clot with several devices. We have aspiration catheters to remove the clots. We have angiojet devices to suck up the blood clots with some plugs. But it only can be done if the plug is still quite soft. Yeah, soft. Like a fresh accident, we can remove the damaged cast. Yeah. But if the plug is chronic, the balloon and devices will not be able to scrape the plug and then remove it, because if the plug is very hard, if we're going to suck out the plug, is technically very difficult, and the risk for the patient during the procedure will be very high. But very rarely in patients with large amount of calcium, the plug is very hard. The stent cannot be inserted through the blockage. We can use a diamond drill. We call this rotablation. I use a special diamond drill to drill open the calcium inside the arteries. And lastly, talking about this plug, since last year there was a latest innovation called the cholesterol busting jet, which can bring down the bad cholesterol to a very, very low level. It seems promising to, with this cholesterol busting injection, that may be able to reduce some chronic plaques in the artery. It's via subcutaneous injection in the tummy.
Okay, thank you very much. Do you recommend the taking of statin daily if our coronary artery 30% blocked by calcified plaque?
Essentially, if the plaque is calcified, you need to reduce the amount of calcium. So some common scenario is that the patient has been taking calcium tablet. If they are taking calcium tablet, they have to reduce the calcium tablet. They also have to reduce food that contains high calcium. For example, cheese, full cream milk, and so on and so forth. Secondly, they need to check the cholesterol levels, and ideally to keep the good cholesterol HDL high, if not higher than the bad cholesterol LDL. So they need to increase the good cholesterol, which helps to remove the plaque, and then at the same time reduce the bad cholesterol, in the bloodstream. Again, depends on the fact whether this patient also has other coexisting risk factors. If he only has high cholesterol, then just control the cholesterol with statin will be the best. If I were this patient, then I would be taking statins more regularly. But taking statins alone may not be enough. We need to make sure the statin is working efficiently by checking the cholesterol ratio, the good cholesterol, and the bad cholesterol level. Yeah, and then of course control our diet, light exercise, check all other associated risk factors. Yeah.
Okay, thank you, Dr. Chong. Just now we talked about a calcium test. The question is that can GP do it, or do we have to go to a specialist to do a calcium test?
Yeah, the GP can refer. This calcium test is usually done in the radiology center, radiology clinic, radiology center, because we use the CT machine. Yeah, the machine. So the specialist will be able to fill up a form, referral form to send the patient to do this test. For example, in Farrer Park Hospital, we can get it done in our level 2 radiology center. Sometimes outside radio center also can get this done. Sometimes the GP do have experience in managing heart patients. Depends on their training background. So some GPs will have the link to these radiology centers. They can fill up a form, just like filling fill up an X-ray form. But then the thing is, once the report comes back, the GP must be able to interpret the results and manage the patient accordingly. Yeah. So it really depends on what type of patient that GP is comfortable to see and manage.
Okay, thank you, Dr. Chong.
I guess if the report comes back to be normal, 0 calcium, then the GP will be happy. Just continue, do whatever you want. Right? But if the result come out like Donald Trump, calcium score 120, then maybe the GP can manage or refer to a specialist to see the patient. Yeah.
Okay.
Yeah.
Does drinking warm water when you wake up before brushing teeth help?
Essentially, drinking water is more related to hydration. Yeah. In particular, water itself does not have direct impact to the heart. Yeah. But of course, drinking warm water is better than drink ice water, better than drink soft drinks. Yeah. The best form of hydration is actually room temperature water, warm water. Yeah. So if the patient do have some vascular disease, morning 1 glass of warm water will will do something good and nothing to lose. Yeah, it will be something good for hydration, good for the cardiovascular system. Essentially, about 60 to 70% of our blood is made of water. Yeah, that is good for. That's good advice. Yeah.
The next question we have here is long-term mild numbness in the limbs at sleep a symptom of blockages that could cause cardiac arrest?
Okay, this depends on the location of the numbness. If the numbness is shooting numbness, all the way from the back, down from the thigh, go down to the calf, and then to the leg, that is sciatica. It's a nerve shooting pain commonly caused by lumbar spine problems. So called shooting pain if the numbness involves the whole leg. Yeah, so normally we will refer the patient to do an X-ray of the spine and then sometimes MRI of the spine. But in some patients, if the numbness focus mainly on the feet alone, the feet, the toes, it can be caused by peripheral vascular disease and or diabetes. So if they have this numbness, then you look at the color of the skin, you can do see a doctor, check the pulses in your feet. If the pulse volume is low and the blood perfusion to the leg actually reduces, and that can be an indication of underlying peripheral vascular disease. In other words, blockage of the blood vessel in the legs that have to be addressed by specialists. Yeah.
Okay. Let me scroll through a number of questions here. There's a question here that if I have a thorough heart check, ECG, treadmill, etc., done by a cardiologist a year ago, when should I go for another test?
So if he already had a heart check, ECG, treadmill, if both are normal, some depends on the age of the patient. Sometimes if the patient is more than 50 years of age, he may want to also do a zero risk test called echocardiogram. It's essentially an ultrasound of the heart. During this ultrasound, we can see the heart muscle contraction to make sure the heart chambers are not dilated, like the athlete's heart. And then we can check the heart valves to make sure that there is no thickening of the valves is moving properly. At the same time, we can also take a look at the aorta, which is the big blood vessel inside our chest, to check if there's any cholesterol deposit. So, and this test has zero risk, so we can opt for ultrasound or echocardiogram for the heart. Yeah, that, of course, it also depends whether the ECG and treadmill tests were normal. Yeah, presume both tests are normal. Yeah.
Okay. Follow up to that question. There's another question here. Let me scroll down. Oh, I think I lost that. Okay,
There's one quite good question. Is low LDL is a definite predictor of low cardiac risk? The
that's
low
right.
LDL has to be taken account together with HDL. In a person with low HDL, and at the same time he has a high good cholesterol, high HDL, then that's a definite predictor of low cardiac risk. But in some patients who has a little bit lower LDL, but they also have very low HDL, so both good and bad cholesterol are low. And the good cholesterol can be even lower, much lower than the bad cholesterol. These patients can also have risk for heart disease. So must taken together with the good cholesterol levels as well as the triglyceride, the blood oil levels.
Okay. In follow-up to that treadmill test, there's a question here. I had treadmill tests done at NHC in June and was told that my heart was as strong as a bull. 2 months later, I had a heart attack. NHC said nothing is 100% proof. What is the effectiveness of the test?
Okay, sometimes this test, this scenario it's not common, but I've seen some patients with this issue. That means, I think, remember a few years ago, there was another patient who underwent this treadmill test and then was told to pass the test. But later on, he was running again, he went for marathon, then subsequently he suffered a major heart attack. This test must taken into account because treadmill is not a definite test as compared to angiogram, coronary angiogram. So treadmill test has to be taken into account with coexisting risk factors and patient's age. Yeah. So, and then we must also check during the treadmill test how much is the blood pressure, how much heart rate he has achieved, and then what's the heart rate he has managed to achieve, how fast the heart rate. Yeah, and we also need to look at the effort tolerance, how fit is the person. Yeah, so he, based on the cases that I remember, the patient ran only 6 minutes. So his effort tolerance is not very good. He only did half of the running, then he was tired. So during that duration, the treadmill test did not detect any obvious abnormalities. Yeah, so it's a pass, it's just a pass, but it's not a very good pass. So in those borderline cases, if the patient also have other risk factors, for example, commonly smoking, this person has been smoking heavily, this patient will still be at some risk. Yeah. Essentially, treadmill test in a very well conducted treadmill test, if it's, say, conducted by myself, cardiologist, who supervise the patient and who present during the treadmill test, the accuracy rate can go until 90%. But a lot of times, say in National Heart Center, will be nurses, technicians, or junior doctors supervising the test, or maybe just by the nurses. So the accuracy test can also be highly human dependent. So the accuracy test is not 100%. Yeah, definitely if the treadmill is normal, you also have to, for myself, I will check how fit is the patient, the heart rate, various parameters. Yeah, in order to improve the accuracy of the overall assessment. So in patients with even past treadmill test, if say this is a smoker, he has high cholesterol, he's overweight, he has family history of heart disease, I will still give the patient essential advice and then ask him to monitor his signs and symptoms and perhaps take treatment to reduce the cholesterol levels. Yeah.
Okay, thank you, Dr. Chong, for the comprehensive answers. Is there any side effect, taking aspirins in long term? Any risk for me if I stop this medication? I have done an angioplasty 2 years ago.
Okay, if aspirin is taking long term, normally we take low dose aspirin, cardiac aspirin, which is only 100 milligram. If you're taking long term, one potential side effect is development of gastric ulcers, gastritis, Sometimes if you do get injury, there's a higher chance of bleeding. If you're seeing dentist, the dentist, you want to take out your tooth, the dentist may ask you to stop the aspirin. Yeah, if the patient do worry about gastric problems, firstly, diet-wise, he must be more cautious, drink less ice, cold drinks, eat lesser spicy food. Take aspirin only with food. That's number one. Number two, if they do have some gastric symptoms or bleeding issues, they can change the aspirin to another milder form of blood thinners, Plavix, or the generic name is clopidogrel. Aspirin comes in 100 milligram. The clopidogrel comes in 75 milligram, which is slightly lighter for the stomach compared to aspirin. And then we need to take at least one blood thinner if we undergo cardiac stenting. Otherwise, the chance of having sudden blood clot formation in heart artery is as high as 10 to 12%. The risk is too high. The risk for severe bleeding with aspirin is usually, especially if you also take with some gastric protection medicine, should be lower than about 1 to 2%. So the risk and benefit ratios are quite different. So minimum world recommendation will be take at least one form of blood thinner if this patient has done an angioplasty before. Yeah.
Okay. Thank you, Dr. Chong. Yeah, thank you very much. We'll take two more questions because Dr. Chong has to attend to another patient very shortly.
Thank you.
Okay, for the rest of the questions, please send them to us and we'll try to get them answered separately. There's a question here. If you survive a heart attack, is your heart back to normal? Can you go back to normal? Can you go back to normal life?
Okay, if you suffer a heart attack, usually we will perform an echocardiogram to ascertain how strong is the heart. Echocardiogram can measure the ejection fraction of the heart muscles. Normally, we give a percentage score. A normal score is about 60%. We call EF 60% ejection fraction. If the ejection fraction is normal, it means the heart is back to normal. Yeah, if it's low, say for example 40%, it means the heart is mild to moderately weaker. And in some patients, we may only have an ejection fraction of 20%, then this patient will have a severely weakened heart muscle. With more medication, cardiac rehabilitation physiotherapy, and the new generation of medications, including the cholesterol busting jab and some heart failure medicines such as Entrestol, the heart muscle may improve the strength. The heart muscle can grow stronger, but they may or may not go back to the normal strength. So it really depends on, firstly, how fast was the heart attack being attended to? How quick was the angioplasty performed? If the angioplasty was performed very quickly, within a few hours, or if even best within 1 hour, there is a reasonably good chance the heart contraction is still pretty good, still normal. But if the heart attack was being attended quite late, it's a delayed presentation, the patient had chest pain for 1 day, more than 6 hours, then see the doctor, go to A&E, then it's more likely he may suffer from permanent heart muscle damage. Once the scar forms in the heart muscles, it's very hard for the scar to return back to normal cells. Then the heart may be permanently weakened. So must be very careful, cannot go back to normal life, must be a much more careful life with very stringent lifestyle, very careful with the medication, do not take any stress if the echocardiogram shows that the patient has a weakened heart. Yeah.
Okay, thank you, Dr. Chong. The last question we have here is, how do I keep, I can't pronounce this, arrhythmia in check? I was prescribed with beta blockers, but I don't feel that it helped with anything.
Okay, one way is you can buy this Fitbit or special watch to track your heart rate, heart rhythm. The newer devices can not only check the heart rate per minute, can also check if the heart rate is regular or irregular. Arrhythmia usually refers to irregular heartbeat. So the most common form of arrhythmia is atrial fibrillation, whereby the small chamber of the heart beat very irregularly. The heart rate can be fast as well. Other form of common arrhythmias include atopic skip beats. Yeah, in some patients, the number of skip beats can be quite high. So beta blockers are commonly used in these two conditions. Essentially, you can track by buying these simple devices. Of course, medically, we commonly perform a 24-hour Holter heart rhythm monitoring, whereby we put a small device with stickers onto the chest of the patient, and then we monitor for 24 hours. The next day, patient come back, pass the device back to the clinic. We can analyze all the heartbeat to see if the heart rate is good, within good range, if there is any irregular heartbeat, any arrhythmias. Yeah, if the patient do have significant amount of arrhythmias based on the test, for example, atrial fibrillation, which can be silent. This could be silent cause of risk factors for heart attack as well. It's just that some patient may not be able to feel it. Then beta blocker will be helpful. It's the concept is very important. One concept is that not all the heart patient can feel it. They may not feel the medicine is doing anything, but if the test does show that it's doing good for the patient, they should stick on with the medication. But objective testing will be useful. That's why one of the most common symptoms for cardiac arrest and heart attack is actually no symptom. By percentage, no symptom is even higher than chest pain. But when the patient feel the first symptom, 20–30% patient feel it in the first time, and this will be their last time. Because the first time they feel the severe chest pain, first time, they die. Yeah, so it's too late. Yeah, that's why even no symptoms, as long as the test shows something, we should take precaution. Because heart condition is the only condition, only very few conditions that causes sudden acute event and takes your life very suddenly. Just like our doctor from SGH. He was perfectly healthy, nothing, perhaps just under high stress. And then just the heart attack can just take his life away just suddenly, yeah. So heart is a magic organ that we really have to take care of, even we do not feel any symptoms. Yeah.
Okay, thank you, Dr. Chong. Okay, we have to call an end to this webinar. We'd like to say thank you very much to Dr. Chong for sharing your subject matter expertise with us. It was indeed a wonderful afternoon, learning a lot from you. I'd like to thank all participants for attending this webinar with Dr. Chong. The questions that are not answered, we will try to get them answered and send it to you as soon as possible. With that, thank you very much, everybody, and have a great afternoon.
Hey, thank you very much.
Bye-bye, everybody.
Thank you.
Thank you.
Stop.